Interestingly, there's a study from the United States that showed that the outcome of the pregnancies of Black women were better when they've been treated by Black doctors. And why would you say that? Are they, Black doctors are better than white doctors?
A world-leading expert and professor known for her work in maternal and fetal medicine. She's renowned for her pioneering work in twin pregnancies, fetal growth restriction, and prenatal innovation. She also featured in that Channel 4 documentary Baby Surgeons, during which she performed life-saving and intricate surgery on an unborn baby. The one and only Professor Asma Khalil.
Thank you very much for having me to send a very clear, strong message to pregnant women that it's safe to take paracetamol in pregnancy. If you had a previous miscarriage and in the current pregnancy you experience bleeding, an early stage in pregnancy, that giving progesterone reduces the risk of miscarriage. So alcohol does cross a baby, it does cross a placenta and affect the baby's development. Sushi, sashimi, again, it's a raw fish and that could transmit infections to pregnant women. So there are general advices to avoid during pregnancy.
What about things like reflexology though? Because sometimes people talk about if you have your feet touched later in pregnancy, that can cause miscarriage. Women over 40, we're seeing loads more women become later stage mums. Any advice for women who feel like they're running out of time, had like a giant grapefruit-sized fibroid removed? What advice do you give to somebody? Because at the time I remember him saying, this is a good thing to do if you want to go on to get pregnant. The information in this episode is provided by a qualified medical professional, but is intended for educational purposes only. Individual needs do vary, so please always consult your own doctor. Enjoy the episode. First of all, you look amazing. You're probably one of the most glamorous, women in the business.
Well, it's lovely to hear that from you, but look who I'm talking to.
Do you know what? We have our rapport because we're connected in a special way that can never be undone, which is that you delivered my 2 children.
It's my pleasure.
So it's so nice to have you on. I think when people see you on the podcast and they tune in, immediately what's going to be exciting to them is the idea that they can get incredible advice that they can trust. Because I think that when you're pregnant, there's all this advice floating around that you don't know whether you can trust. And there's sometimes myths and there's almost like superstitions. And then there's things that go out in the press and in the world news and you're like, can I take paracetamols? And all of that kind of stuff. So I'm going to start off by going through a bit of a general pregnancy Q&A. I want you to give me a comment on whether these things are safe or risky during pregnancy. And if they are risky, if you could elaborate a little bit. You ready?
Yes.
Okay. Paracetamol during pregnancy.
Oh, well, absolutely safe. So paracetamol is safe to take in pregnancy. It does not cause autism or ADHD or intellectual disabilities. And just to give you a little bit of background to that, so in September 2025, there was an announcement by the US administration that highlighting that paracetamol causes autism in children. And that obviously was scary to the pregnant woman. And I remember at that time I had 2 pregnant women coming to me asking for an ultrasound scan to see whether the baby have autism or not, because they had paracetamol or Panadol or United States called acetaminophen when they were early in pregnancy. And they were really scared and they were feeling really guilty that they might have harmed the baby. So we did the study because as a researcher, you have this curiosity. Is that true? When President Trump announced it, and that we should not take paracetamol in pregnancy, and it's the commonest medicine we give. It's if you see about 2/3 of pregnant women will take paracetamol at some point during pregnancy for pain or temperature. So when we did the research and we found that there was no relation, there's no link between paracetamol use in pregnancy and autism or ADHD or intellectual disabilities. And we published that in one of the Lancet journals. So that's one of the leading journals in our specialty. And that went viral, in a matter of 24 hours. There's more than 1,000 news channels were saying, look, the evidence is reassuring, so send a very clear, strong message to pregnant women that it's safe to take paracetamol in pregnancy.
Thank goodness, because, from my experience, paracetamol was incredibly helpful. So that's
And
good to know.
not treating fever in pregnancy is dangerous. I mean,
Not treating fever is dangerous.
Yes, of course. So fever, we know that increases the risk of miscarriage or premature birth or birth defects or developmental problems. So I think we have to be really careful when we give public messages, particularly to pregnant women, which is not supported by robust evidence.
Amazing. That is great to know. Antibiotics.
It depends on which type of antibiotic and what stage in pregnancy. There are many antibiotics that are safe. And again, is the fact that actually treating infection using antibiotic is much better than not treating infection because, again, infection in pregnancy can be harmful to the baby. And therefore, I think the message is that make sure that you ask a doctor. And if you are taking antibiotics that have been prescribed by a doctor, don't stop them early without an advice. And of course, don't take it just without an indication. So it's safe when it's prescribed by a doctor and complete the course. Don't stop early, but don't give it without advice.
Okay. Obesity.
Obesity can be dangerous, can be risky because it increases the chance of problems during pregnancy, like developing diabetes or babies that have developmental problems or baby becoming too large and therefore the problems during the delivery, needing cesarean section, trauma during birth. And therefore, I think, again, advice is that try your best to lose weight before you get pregnant. I think it's easier said than done because, exercise and losing weight is not easy for pregnant women or for even women in general. But I think definitely avoid obesity if you're planning to get pregnant.
And then the opposite, being underweight.
It also, underweight can be risky primarily because of nutritional deficiencies. So they can maybe make the baby small or maybe having anemia, so that's low hemoglobin or the red stuff in your blood. But it's not too difficult to manage because you can give vitamin supplements, for example, or you can support through diet advice. But again, it is potentially risky, particularly in extreme situations. So underweight is something when we define when your BMI or body mass index less than 18.5. So again, avoid underweight.
Okay, so being in a healthy weight range is the best so that when you go into pregnancy.
And therefore, I think that's really important, this preparing your body before you get pregnant to be in the best health state so that you can maximize the chance that you can have a healthy baby and healthy pregnancy.
That's a good one that we'll definitely refer back to, actually. Alcohol.
Dangerous and risky.
And there's no safe limit at all to alcohol?
No, there's no defined safe limit. We know that alcohol in pregnancy can increase the risk of the baby being too small or maybe having premature birth or having developmental problems or birth defect. We should all know about something called fetal alcohol syndrome.
What's that?
Fetal alcohol syndrome. So this is a problem that affect the babies when women consume large amount of alcohol during pregnancy. And these babies can have birth defects, they can have developmental problems, they can have intellectual disability. And therefore, I think the advice is very clear for women who are trying to get pregnant or are pregnant to avoid alcohol.
And what does it do on a sort of biochemical level? Is it because it crosses over into the baby's bloodstream?
Yeah, so alcohol does cross to the baby, it does cross the placenta and affect the baby's development. I mean, it's also important not to scare pregnant women. So it's not unusual that women might have exposure to alcohol or have been in a party, they were drunk, they had consumed large amount of alcohol or on holiday, and then after that they discover that they are pregnant. And therefore, I think, the advice is that once you realize you're pregnant, you need to stop.
Okay. Smoking.
Risky, dangerous, because again, smoking can make the baby small, so it affect the baby's growth, again, increase the risk of premature birth, again, causes developmental problems. And of course, it as in terms of the mother's health herself, that again, you're more likely to have chest infections, might affect your immune system. And therefore, again, the advice is to stop smoking. And then there are helpful things now, so nicotine replacement patches that they are helpful to encourage women to stop.
They're okay,
smoking.
Are
they? They are, and in fact, they are much better compared to smoking cigarettes or vaping.
And does that not cross over then? Because with the nicotine patches, it goes into your bloodstream, but it doesn't cross over to the baby?
Yeah, so sometimes it's not the nicotine itself. Sometimes it's what so that when you smoke a cigarette, there are actually toxic substances in the cigarette, on the smoking itself and the fumes, and that can be more harmful to babies compared to the actual nicotine itself.
Got you. Recreational drugs.
Of course, dangerous, so risky. Things like heroin or cocaine or other substance, absolutely the advice is to stop during pregnancy. They can, again, cause baby to be small. They can increase the risk of premature birth. Also withdrawal symptoms after the baby is born. And for particular drugs like cocaine, it can cause abruption. This is something when the placenta separates from the womb and causes bleeding, and that can be very dangerous for the baby and can cause stillbirth. So that can cause the baby to die during pregnancy.
Wow. High energy exercise.
They're not really risky. I think there are many benefits of doing exercise in pregnancy in terms of actually the physical benefit of exercise, also the mental benefit of exercise. But of course, don't overdo it. So be sensible, listen to your body. As long as you can maintain conversation while you are exercising, it's safe. But of course, if the bleeding has problems, so if you're bleeding, for example, or you broke your water, or there is a chance of premature birth, in this case, we'll advise you not to do high energy exercise.
So listen to your body when it comes to pushing it.
Yeah, but I don't think we should tell pregnant women not to exercise. I think it's good to exercise, but if you're not someone who have been going to the gym, don't start going to the gym during pregnancy.
So do what your body's used to.
Correct.
So on that note, if you are someone that's doing like 5K runs, 10K runs, could you carry that on right up until the third trimester?
I think if you're comfortable and you're used to that, I think that's fine. But of course, avoid situations where might cause trauma. So, for example, if you fall on your pregnant bum,
accidents.
I think that could potentially be dangerous for the pregnancy. Also depends on the type of sports, like avoiding it's like, horse riding, for example, because again, the risk of trauma, or contact sports, because again, the risk of trauma. Avoid, overheating your body. So I think just be sensible.
Sex.
Safe in pregnancy. It's not dangerous. It's not risky.
At all stages of pregnancy?
Yeah, but obviously later in pregnancy can be more uncomfortable for the woman. Some women say maybe they get a bit of some cramps after sex. Certainly if you have bleeding or if you're leaking fluid, the advice is to avoid vaginal sex.
Okay. Flying.
Safe. But of course with advice that depends on how long the flight is, to take precautions to reduce your risk of developing a clot in your leg. So when you're pregnant, because of the changes that happen in your body, you're more likely to develop a clot in your leg. So particularly if you're having a long-haul flight, in this case, you need to take extra precautions to reduce that risk. So that means wearing stockings, making sure you're well hydrated, so drinking plenty of fluid, maybe getting up and walking up and down the plane, so the bit of exercise. And of course, depending on what's your chance of developing a clot in your leg, sometimes we might give extra medication to reduce the risk of developing a clot in your leg.
And I always hear things about, deep vein thrombosis and leg and clots, but I wouldn't say that I fully understand. Is it a circulation thing? And why is it dangerous in general in pregnancy? And then how do the stockings and things like that work? And how does the movement work to reduce it?
Yeah. So DVT, or deep venous thrombosis, is potentially very dangerous. And you're right, it's because of the circulation. So, for example, if you're sitting for long hours, not moving, the circulation in your leg doesn't move, and therefore you're more likely that the blood in your blood vessels clot. And that potentially can be very dangerous because this clot can send showers to your lungs. And therefore, having a clot in your lung is very, very dangerous.
Wow.
During pregnancy, because of the changes that happen in your body and the pregnancy hormone, the chance of developing a clot or deep venous thrombosis is higher.
Okay.
And therefore, when you are, and particularly in circumstances where your chance of developing DVT is higher, like being on a flight for 10 hours, and you're pregnant, that means the chance is even higher.
Got you. Arguing with your other half.
I think it depends. Regular arguments, they're not dangerous for the mother or the baby. But extreme circumstances when it's sort of physical or emotional abuse, or if there is chronic stress or the pregnant woman feels not supported, I think that could potentially be dangerous. And that applies also to stress in general. I think everyday stress, I think, is fine and it's not dangerous. But having, severe stress or chronic stress can have detrimental effect on the baby and the mother.
What would be an example of chronic stress? Because I think a lot of people might think, how stressful? Like, a lot of people might think, okay, I certainly remember when I was pregnant that I would worry if I got stressed because I didn't know what level was like a dangerous level. You kind of just hear these kind of whispers that don't get too stressed, you're pregnant. But then every day brings stress. And plus, when you're pregnant, you feel different because you're hormonal. So what would be an example of chronic stress that you would really want to avoid?
And being in an abusive relationship, I think that's a form of a chronic stress. And that could be, I said, emotionally, but also could be physical.
Yeah.
And that certainly can increase the risk of, depression, anxiety, to the extreme of committing suicide. So definitely the advice is to avoid that. But everyday stress of, arguing with your other half or, work, for example, that's fine. And I think most women can cope with that very well.
Okay, lifting heavy things.
I think you have also be careful because the changes that happen in pregnant in the body during pregnancy. So your joints tend to be a bit loose, and therefore they're more likely to have to be undergoing strain. For example, if you lift heavy things, or suffer from like really back pain or joint pain or pelvic pain, and therefore again the advice is to avoid heavy lifting during pregnancy.
If you're bleeding during pregnancy, is this risky?
I think it depends on how much and at what stage in pregnancy. So bleeding mild or spotting early in pregnancy is not uncommon and is usually not dangerous and usually settles. But if you have heavy bleeding or particularly bleeding in the second half of the pregnancy, that could potentially harmful and could indicate that maybe something wrong going on. And therefore, I think the advice is definitely seek medical advice, go and have a checkup, make sure that they know where is the source of the bleeding and if it's something that's affecting the baby.
Okay, and I'm going to go back to that in a moment because I'm going to ask about when people have miscarriages and things that they can do the next time around, because I remember advice around progesterone, but I'm going to ask you about that. Seafood.
Seafood is usually good to have because it's a source of protein, a source of iodine. There are some vitamins. But also there is you need to be careful because they're like tuna, for example, or shark. They tend to be rich in mercury, and therefore we would avoid consuming large quantity of them in pregnancy. Sushi, sashimi, again, it's a raw fish, and that could maybe transmit infections to pregnant women. So that general advice is to avoid during pregnancy.
Okay, so it's the fact that it's raw or the fact that there's a lot of mercury in it that could be the issue?
Either. So avoid too much tuna because it has mercury, and then avoid raw fish if you can.
Okay. What about being exposed to like a sick bug or flu?
Majority of the times it's not that dangerous. It's unpleasant and the fact that you might get dehydrated. And usually, but it's transient and usually gets better quickly. But if it's, causing temperature, for example, I think that could potentially be dangerous. Or it makes a woman dehydrated. Or if there are other symptoms. So other things that could indicate that maybe severe infection.
What about going for a massage at a spa?
I think it's lovely to have a massage. I think it's nice for the relaxation. It's good sort of for maybe the swelling or just sort of the relaxing the body and the joints. But again, it needs to be done by someone who's experienced in doing massage in pregnancy to make sure you avoid certain positions. So you don't want the pregnant woman to be lying on her back because that can affect the blood supply to the baby. And therefore, I think if it's just done by the professional person that have the expertise how to do massage safely in pregnancy, it's absolutely fine. It's not dangerous.
What about things like reflexology, though? Because sometimes people talk about if you have your feet touched later in pregnancy, that can cause miscarriage.
That's a mess.
It's a myth.
Yes.
Okay, you heard it here. And on that topic, sometimes spas will avoid you after the first trimester. They don't want you in there.
Yeah. I think it's also spas that's safe. I would say maybe avoid being in sauna for a long time because of the overheating your body.
Is that dangerous?
Potentially, yes.
Okay, so saunas and jacuzzis when you're pregnant, not an idea.
Yeah, I mean jacuzzi again. If you are, for a short period, I think that's
and it's not
absolutely
too hot.
safe.
If you can tell when something's too hot, can't you?
Yeah, and jacuzzi most of the times is not too hot.
It's more so the sauna situation.
The sauna, I would say, because it's overheat your body. But again, spa is safe usually.
And on that note, what about essential oils? Because some people say that you should avoid essential oils in pregnancy.
Why would you avoid essential oils?
I don't know. There's just like a lot of talk around like certain essential oils. So that's not something that you subscribe to, that viewpoint.
I'm not aware that there are any oils that would be dangerous.
Okay, good to know. Caffeine?
I think again in moderation. So there are some studies that suggest that maybe consuming large quantities of caffeine might be associated with the risk of miscarriage, and therefore I think the advice is everything in moderation. So if you can consume about 200 milligrams per day of caffeine, that should be safe. And I think it's important to realize caffeine is not just coffee. So you can have caffeine in other
Chocolate.
Tea, chocolate, Coca-Cola. That has a lot of also energy drinks.
Yeah.
They have a lot of caffeine, and therefore just be sensible. And I would say maybe having one regular mug of coffee a day should be absolutely safe.
Okay.
Again, early stage in pregnancy, because of this potential risk of miscarriage, so maybe having decaf, I think that would be fine.
Safer.
Yeah.
Sleeping on your side.
I think that's absolutely safe. In fact, we do recommend you to sleep on your side, not to sleep on your back.
Okay.
But that's mainly after, I would say, in the second half of the pregnancy. I think the first half is fine.
Okay.
And really the rationale behind that is that when the baby is growing and the uterus is getting bigger, it causes pressure on a blood vessel that runs in your back.
Mm-hmm.
And that means it might affect the pregnant woman's blood pressure.
Mm-hmm.
And that can affect the blood flow going to the baby.
Okay.
And therefore, definitely in the second half of the pregnancy, it advises to sleep on your side rather than on your back.
I remember I'd wake up in the night and be like, but on my back, oh no.
Yeah, but I mean, the truth also that, you go to bed, you go to sleep in a certain position, and you get up in a different position. How would you control yourself during the night?
Exactly.
Difficult.
It's just good to have in mind. I wanted to touch briefly on people who've experienced miscarriage before, because it happened to me and my husband and I. And then what we then navigated was trying to, the next time round, do certain things. So, for example, the fertility clinic that we were talking to, we didn't actually end up doing IVF, but they gave us some advice. So they got us to take mini aspirin as a blood thinner. Is this something that you agree is like useful?
Yeah, so many women are advised to take baby aspirin or the mini aspirin, and it does have some benefits. I see many patients who, let's say, had IVF, and many of them will be advised to or given baby aspirin. I think in pregnancy, there are the advice or what we know for sure from robust studies that giving baby aspirin or the small dose of aspirin to women who have high chance of developing high blood pressure in pregnancy or preeclampsia, that giving them aspirin reduces the chance of developing high blood pressure or preeclampsia. It also reduces the chance of having a very small baby or baby that's not growing properly. So the aspirin in pregnancy can have potential benefit, particularly affecting the placenta. So making sure that the placenta works properly. And if there's a chance that the placenta might not be working well, the aspirin might correct that.
And is that something that could affect like early pregnancy, where miscarriage tends to happen the most because it's helping the flow of everything because the blood's thinning?
Indeed. And I think that's probably the rationale behind women undergoing IVF, that the IVF clinic would advise them to take baby aspirin.
Yeah.
I think it's also important to to maybe take the opportunity to advise them. So if someone during pregnancy and experience bleeding and they are taking aspirin, that they should stop aspirin until they see their doctor and get advice about when to restart the aspirin. So if you're bleeding, stop the aspirin until you see your doctor, and then when the doctor advises you when is the right time to restart the aspirin.
Actually, on the topic of bleeding, do you think that progesterone, because I've seen that there's research around progesterone when as soon as you find out that you're pregnant, taking those, which you can obviously take as pessaries, they're like waxy things, aren't they?
Yeah.
Taking those can be a good way of preventing miscarriage and stopping bleeding?
What the evidence showed is that, or the trial or the study is that if you had a previous miscarriage and in the current pregnancy you experience bleeding at an early stage in pregnancy, that giving progesterone reduces the risk of miscarriage. And therefore it's becoming now common practice that when women have a bit of bleeding early in pregnancy, that the doctor will give them progesterone. And progesterone is safe. We have plenty of data and plenty of evidence that progesterone does not harm the baby.
And natural killer cells, some of the clinics now, I mean, it is a very expensive test, but I just wonder your opinion. And I know we haven't got long because you've got patients and stuff. But in terms of, I remember and this is really important for people who don't have the money to do these things, but to know about it. So there's certain clinics that you might go to in Harley Street where they'll say, right, if we do this really expensive blood test on you, we're going to tell you whether you have like natural killer cells, which could be, I think, attacking a potential baby, and hence the reason why you might have recurring miscarriages. And then if they find that you have got natural killer cells, they would give you something which is like, you go on a drip and they give you something that's like, it sounds weird, but you get like, it's like a mayonnaise drip. You get some sort
of intralipid. It's called
intralipid.
Yes.
And so do you believe in that as a process from your research, and how does the intralipid stop the natural killer cells from affecting a baby?
Yeah. Look, I mean, it's a controversial area. I think some doctors would recommend and some doctors will feel that it's not needed. It's not really my area of expertise, IVF. I do more maternal fetal medicine. But I see many patients who have been to these IVF clinics and they were advised to, they check their natural killer cells and then they give them intralipid, and some other clinics where they would feel strongly that that's not useful. I think the practice varies.
Okay, very quickly, fibroids. Many people affected by fibroids, in particular women of colour. And I remember when I had a fibroid, I had like a giant grapefruit-sized fibroid removed. What advice do you give to somebody? Because at the time I remember him saying, this is a good thing to do if you want to go on to get pregnant, because obviously sometimes fibroids can be intrusive in the womb, right?
Yeah. So fibroids, as you mentioned, fibroids are relatively common, particularly in women of colour. And the good news is that the majority of the time, they're not harmful. And women can get pregnant with no problems, and it doesn't really harm the baby or harm the pregnancy. But in particular situations where maybe if it's very large or there are many of them, or actually the position of the fibroid inside the womb, so particularly if they are affecting the lining of the womb, they can actually affect your chance of getting pregnant. And that would be situations or circumstances where the recommendation is to remove the fibroids. When you remove them, I think obviously looking after you during pregnancy, sometimes they still have small fibroids and sometimes they grow during pregnancy. I think in terms of the position of these fibroids, because that might affect the chance of whether you're able to give birth normally or not. And then also, if you had the fibroids removed, it depends whether what technique they did during the surgery, because sometimes we will advise you to have cesarean section because maybe it's too risky to give birth if the fibroid during the removal they actually opened the lining of the womb. So it might have some implications in pregnancy. If you have very large fibroid, sometimes can cause pain during pregnancy, sometimes makes you quite sick. So there are some implications, but the message is that it's in more than 90% of pregnant women who have fibroids, it's safe, it does not harm the baby or the pregnant woman.
Okay. I'm going to squeeze in 2 more questions. One is on the topic of Black maternal health. Now, that's something that you've, looked at, you've been involved in research-wise as well. And when we had our chat on the phone when we were having like a little research conversation, you told me something that I thought was fascinating that I'd not heard about before. So first of all, if you wouldn't mind just talking on like what the disparity is, like the difference between Black women, their outcome when they're pregnant, childbirth, statistically, and then also what you said to me about Black doctors and and the outcomes there.
Yeah, it's really sad, but what we know from the data that in the UK, Black women are 3 times more likely to die during pregnancy compared to white women. And they're also 3 times more likely to have stillbirths. That means death of the baby during pregnancy compared to white women. And you see similar pattern also from women from Asian background. They're about maybe twice as high, twice more likely to have stillbirths compared to white women. And it's not just a problem that's in the UK, but also if you look across the Atlantic in the United States, you see similar pattern. And the obvious question, number one, is why? And the second, very important question, what are we going to do about it? Why? I think there are a number of factors that are probably contributing to this disparity. Apart from the fact that, maybe that the health and the care and so on, I think certainly there is a concern about this unconscious bias, that the fact that there is this institutional racism, the fact that doctors are not necessarily racist, but there's this unconscious bias that they treat women from different background differently.
And have you noticed that in your experience?
Yes, I think that's something that happens, of course, on a daily basis.
What would that look like in practical terms, like in terms of what a doctor might do or how they might behave or communication?
I mean, I think it's usually probably unconscious bias of the fact that you tend to maybe stereotype or maybe say, well, yes, they have higher risk of problems just because biologically they're different. And, that I don't think that the scary statistics that I mentioned earlier could just be explained by biological differences. That's not the case. I think there's definitely disparity or difference in the care that's provided, and that's been shown also in the data. Interestingly, there's a study from the United States that showed that the outcome of the pregnancies of Black women were better when they've been treated by Black doctors. And why would you say that? Are they, Black doctors are better than white doctors? And I suspect is because there's something about understanding the culture and being able to have the patient trusting in the doctor that they look after. Certainly, if there is an issue of mistrust and I have the doctor who come from my background, understand my culture, can speak the same language, and trust or sort of respect the way I think, the way I practice, the way I want to make decisions, that I'm more likely to follow the advice and being able to be open about it, about any problems or symptoms that I have. I think there is this concern that maybe people dismiss some of the symptoms of women from certain backgrounds because they say, well, yeah, I think they just cope with pain this way, or they always complain about that. And you hear it all the time from women saying, I've not listened to. That's you see that in the headlines, unfortunately, recently. And therefore, I think the advice of what we're going to do about it, I think that's really for me is that we need to stop admiring the problem and we need to focus on solutions, because report after report after report showing the same statistics. And, we can carry on admiring the problem, but actually a much better way of addressing it is to focus on the solutions. What are we going to do about it? And certainly, apart from investing in healthcare and ensuring that we have the right resources, I think it's very important to train doctors in different cultures and train them from early stage in their career about what the culture look like. What's normal for women from different cultures, what's abnormal, and ensuring that the people listen and understand that yes, we have different cultures, but biologically we should be similar and we should have similar outcomes.
Wow, amazing. And I know you've had letters from people before telling you how much you respected their differences, whether it was religious differences, ethnic differences, and so that's why it's amazing to have a doctor like you if someone's lucky enough to get someone like
Yeah.
you, a woman of colour, and also just somebody who has that mindset and that understanding that other people could be, operating from a position of a bias and unconscious bias.
Yeah.
Um,
So I'm a senior obstetric lead for the NMBA. That's a National Maternity and Perinatal Audit in the UK. So we have data from across the country. And what we found, apart from actually the outcomes that are disproportionately worse for women, for example, from Black women, also what we found that the way the care that they receive was also different. So in terms of pain relief in labor, interventions in labor, they're also different. So we cannot really explain that biologically. There is inherent differences in the way we actually look after them that cannot be simply explained by biological differences.
so a message to your fellow doctors and consultants then when they're dealing with women of colour.
I think we need to train healthcare professionals, whether doctors or midwives or nurses, in the culture and understanding that there are cultural differences, but also learn to listen to patients, don't dismiss their concerns, don't stereotype people, and really be a compassionate doctor. Make sure that it's not just about being professional, it's also being the caring doctor that care about. It's not just a pregnant woman, it's an individual, a human being, and understand where they're coming from, what affects their everyday life.
Oh my goodness, bedside manner so important. And also I think Black women, sometimes people just assume, you're not in pain, you can withstand anything. And, like you're talking about the pain relief.
Yeah.
Before you go, my last question to you is, women over 40, we're seeing loads more women, become later stage mums. Any advice for women who feel like, they're running out of time, whether it's medical advice or just lifestyle advice?
Yeah. I mean, it's true that we know that women getting or delaying pregnancy until later stage in life. And despite the fact that some people would say, oh, women are becoming a bit selfish and delaying the pregnancy, I think it's actually the pressure on women of, the equality, the career, until they find the right man that they want to have a baby with. But certainly for a woman, if you definitely want to have a baby, try to have the baby early, don't delay it. Because obviously as you get older, the chance of getting pregnant is lower and maybe more difficult. A chance of needing IVF treatment tend to be higher. So if you definitely want to have a baby, try to do it early if you can.
What does early look like?
Before 35. It's not always easy. I think it's easy for me to sit here and say, well, if you want to have a baby, try to get it before 35.
But I think it's real advice though, because I think we are living in a time where everyone's like, you can do what you want when you want, and it's actually not true.
Correct. And I said that sometimes I think women pay the price of what the society has decided. So the society decided that we should have equality, correct? That
We're not
women should
equal.
have career progress. I mean, yes, of course we want to be equal, but there is a biological clock that the woman has, which is different from men. And I think what we really need is to ensure that women are supported. So they do have, yes, if they want to have a successful career, that's fine, but we need to have the flexibility and the support that they need to be able to have this career, successful career, but also have the opportunity to have a child if they wish to do so. Suppose you don't, which at the moment I said that, you want to be equal, you want to have a successful career. It's not easy to find, the right man that wants to have a baby with you. And if it is, I think what you need to is to make sure that you understand the risk. As I mentioned, just try to have your body in a healthy state when you're trying to get pregnant. So making sure that you got the right weight, making sure you exercise, you're healthy. If you have any medical problems, that you need to make sure that they are controlled and you have the right medical advice before you contemplate or attempt pregnancy. Because it's true that when you are a bit older, you have a higher chance of miscarriage. You have a higher chance of infertility, not being able to get pregnant, or developing high blood pressure in pregnancy, or needing cesarean section. And therefore, I think, again, if you want to have a baby, try early. If it's not possible, try to get medical advice before you attempt IVF, for example.
Amazing. Thank you so much.
No problem.